convert your vitamin D1 into D2. And then it goes to the kidneys and converts to D3. And if your kidneys aren't functioning good, which sugars and viruses ruin your kidneys and make it so they don't convert to D3, then you don't ever get the D3. So we have to take a supplement of D3. Okay. Yes.
The sugar in fruits, is that the sugar that you just talked about, or the refined sugar?
Okay, the sugar in fruits isn't as bad as just the refined sugar. Refined sugar, it used to be bad for you, but now it's even worse because it has a lot of genetic modified viruses in which affect our kidneys and cause problems. So avoid beet sugar, because about 90% of the beet sugar in the United States is now genetically modified, and it will have bad viruses in it. You just can't refine the viruses out. They're there, and they get in your body and they cause problems. So in answer to your question, fruits have good sugars, but they have lots of vitamins, lots of minerals, and lots of other good stuff. And vitamin C, you know, most fruits have vitamin C. And vitamin C is the best antioxidant there is. So eating fruits and nuts and berries is so good for you. Actually, I am a big advocate for eating a paleo diet because of the nuts, the fruits, and the berries. And fresh fish, good omega, you know, and most Caucasians need to eat fish every day because it gives us lots of good omegas and proteins. I was told by St. Germain I was not getting enough protein eating the diet I was. I was mainly vegetarian. I'd once in a while get, you know, some meat into me, but he said I needed protein every day because my body needs more protein. And I was actually losing muscle mass, you know, because I was eating too much vegetables. Go ahead.
Just real quickly, being vegetarian and adding to that, eating a lot according to the season, I'm just thinking of how blessed we are when we follow that, because right now the pomegranates are just gone. That's what I have for my breakfast. And they're so high in vitamin C, and they look like red blood cells. So you know it's got to be strengthening, you know, the signs of nature, the signatures of food.
Yeah.
Full of red blood cells, and it has chambers like the heart. So there's all kinds of signs there of preparing and helping you into the winter months.
Eating the proper vegetables and fruits is very important, and the look of them actually helps. When we were in Israel, our tour guide told us that the pomegranate had 714 seeds in every pomegranate, and it was the same amount of bones, organs, you know, all the different parts of your body add up to 712. And so it's good for everything in the body, the pomegranates are. So thank you for bringing that up. Yeah, it's fascinating. Go ahead.
Hey, I'm confused when it says, you know, you go to the store and it says vitamin D and then it says vitamin D3.
Mm-hmm.
If you took vitamin D, would that give you vitamin D3?
Plain. Well, let's look at that. There's several types of vitamin D, and the deficiency is associated with higher cholesterol levels. Now, 95% of the population has too low vitamin D, and so their cholesterol goes up. Why? Your body knows you're lacking vitamin D, so it's trying to get more to the surface of the skin to be converted into vitamin D1. Okay? Isn't that interesting? So our cholesterol problems are due to lack of vitamin D. If you take vitamin D, your cholesterol will come down. Okay, now let's go to the next part. Oh, vitamin D suppresses renin, another chemical that leads to hypertension. And
Have they also found that the sun and your body are the most efficient way to create vitamin D?
yes, absolutely.
Yes.
And they've told us to slap sunscreen on us. You know, I never believed that. And I did this little experiment out on Lake Powell. I used to love to go to Lake Powell, and I had a boat, and we would go out there. And what was fascinating was this one day, my kids are slathering the sunscreen on, and I'm not doing it. And they go, "Dad, put your sunscreen on." And I'm like, I'm blessing the sun that it won't harm me. And I'm just going to let it give me lots of vitamin D. And my kids were like, "Dad, you're nuts."
What about all the chemicals in the sunscreen?
Exactly, they
Yes,
bake
you're
into your
gonna end up with
skin.
cancer, and then
Yeah, but
the
you
sun
know,
is just trying to
according to the medical establishment, you better not let the sun into your skin.
Yeah.
Anyway, the end of the day, guess who was sunburned?
Them.
All of my kids. I didn't get sunburned because I blessed the sun to just give me the good stuff, you know? And we can do that. And it's really interesting. I haven't had skin cancer since malignant melanoma because I've gone out in the sun. Okay, we're getting late here. So in answer to your question, the vitamin D3 is the most powerful form. And it, like I said, you get D1 from the sun, goes to your liver, converts to D2, goes to your kidneys, converts to D3. So you don't really need to take a vitamin D supplement if you're out in the sun enough. Isn't that interesting? So you need to go out naked in the sun, enjoy yourself. So, yeah, and then all your neighbors will call you
The sun
in.
before 10, 11 o'clock is not that dangerous, and then after 3 or 4 o'clock in the afternoon, it's not that dangerous.
Yeah.
And at sunrise and sunset, there's no UV rays at all.
Yeah, yeah.
Those lamps that you're supposed to, people back east especially use a lot of the lamps to get their sunshine. Is that
Yes.
what the same?
The lamps can help. Yeah, the UV lamps. Now, the UVA is the good, ultraviolet light. UVB is bad. So B is bad. Ultraviolet A is good. But I believe that if you tell the sun not to harm you, it will not hit you with the UVB.
The sun is a living being too.
Yeah.
Yeah.
And we can ask the sun to
It
bless us.
wouldn't exist without it.
Two things. One, when I started adding D into my daily routine, I don't get burned as quick. Two, and I think you're gonna address it about D3 being less toxic or less whatever, I don't know the word you wanna use. The medical establishment that I work for always said vitamin D, you could kill yourself, it's with too much of it. And
What happens when you get too much vitamin D? You remember what happens
no.
to you? You get brittle bones.
Oh, that's right, okay.
Because you get too much calcium in your bones.
Yeah, well,
Well, you know, that was brought from ancient history forward into the medical establishment. It was taught to all the medical doctors for years, and they
That's
have
where-
not found too high of level of vitamin D
Right.
anymore.
and then
So
the
that's a
K2.
fallacy.
And then you're gonna talk about the K2 combo.
Yes, the
Okay.
K2 is very important. Now, warfarin or coumadin actually lowers your vitamin K. And vitamin K is important to a bunch of chemical reactions in your body that actually produce enzymes, helps your tissues be stronger, less inflammation. And so they found really good things with vitamin K, but all the doctors out there, when you have a blood clot go into your body, what do? Put you on heparin, which thins your blood through destroying the vitamin K,
And no K.
or coumadin, which destroys the vitamin K. So it's interesting because vitamin K, you know, when you take coumadin, it lengthens the time it takes for a clot to form, and it gets rid of your vitamin K. Now, K has a couple of forms. Vitamin K1, which is phyloquinone, and it's found in green vegetables. It goes into your liver, and it helps maintain a healthy blood clotting system. This is the kind of vitamin K they give to infants at birth. You know, they used to give them vitamin K. I don't know if they do anymore because I haven't been there, done that. But anyway, it keeps the blood vessels from calcifying. Isn't that interesting? Vitamin K1. So you need K1. Now, it converts in the healthy kidneys to K2, but also your good bacteria can make the menaquinone, the K2, in your body, and it helps in your gut. It's not well absorbed, but it also protects blood vessels, bones, and tissues by helping magnesium to soften hardened blood vessels. Helps the bones by getting a right combination of calcium and magnesium. So when you have too much vitamin D3, you add K to it, it makes it work better. Isn't that interesting? So you don't have to worry about taking too much vitamin D3 anymore for any medical reason, because if you're taking the K to it, it normalizes it. Now, nattokinase is one of the best things you can take when you're having any kind of heart disease, because it normalizes K2 levels, it helps the blood vessels clean out, and does all kinds of good stuff. Now, when you have liver disease, you can't convert the sunlight. See, cholesterol plus sunlight gives you D1, and it makes D2 ergyl calciferol in the liver. And if you're having liver problems, you won't convert it. So people who are getting liver disease, which is because of too much sugar and other things, it won't go to the kidneys and become the best form, the D3, the calcitriol. Trial means it's got 3, and that's why they call it D3. So anyway, we're kind of out of time. Do you want me to keep going for a minute?
Yeah.
Okay. So let's talk a little bit about arteritis vasculitis. I had a guy, well, actually his wife called me 5 years ago. He was dying. He was 82 at the time. And they had enough money, you know, and everything, and they had gone the medical route. The guy was still dying. And so his wife called me up because she heard I could help cure incurable things. And through my intuition, I got really strong. He had full body arteritis vasculitis, which means all his blood vessels were diseased with bad bacteria. Now, the medical doctors do a test known as a CRP, and they can do a CRP, which is a cardio C-reactive protein. All C-reactive protein is a sign of inflammation and a bacterial infection by atypical bacteria. And his was off the charts. And so we put him on an arteritis vasculitis protocol of herbs. Now, he was dying not only of heart disease, but disease, you know, he had claudication and problems with his legs and his arms and his hands and his feet. Everything was just infected, and he was dying. And so we put him on a protocol to get rid of the arteritis vasculitis. And anyway, the treatment, one of the treatments is nattokinase. Isn't that interesting? And the other treatment is serrapeptase, and because it dissolves the internal scarring and the tissue damage. And the other thing we put him on was herbs to fight the atypical bacteria, because he was loaded with it. And the systemics number 3, number 4, number 5, taken all at the same time, will kill atypical bacteria, which is cool. I don't know of any other thing. Doxycycline will also do it, but it's an antibiotic. It kills your good bacteria. But these don't kill your good bacteria. These just kill the bad bacteria, because they vibrate at the vibration to get rid of it. The VIVI, they've found, also helps with the abnormal virus and atypical bacteria. So I put him on all of this stuff, and the nattokinase and the serrapeptase. I also put him on skinny fruits, which is actually got a lot of raspberry, blackberry, boysenberry, all the berry material in. And they're very powerful for getting rid of atypical bacteria and virus. And then we put him on the grapeseed extract, which is a very powerful antioxidant and helps repair the blood vessels. We put him on vitamin D3 plus the K2, half a dropper 3 times a day. We put him on citrulline, which is an amino acid that repairs the blood vessels. We also put him on resveratrol, and I put him on 1,000 milligrams a day, because resveratrol repairs the blood vessels. The French, in the French study, they live 10 years longer than everybody else because they drink so much dark red wine, and it actually helps repair the blood vessels. Because it has high quantities of resveratrol. But I don't recommend going out and drinking a bottle of wine every day. Just take the resveratrol. Now, also I put him on magnesium. What's that?
Oh,
Darn. Yeah, the alcohol has other effects on the liver that damage the liver. Anyway, vitamin C with bioflavonoids that we were looking at, Marilyn, The one that you had in your hand was the one I put people on because it's got the 500 of the vitamin C and the 500 of the bioflavonoids. Now, what is bioflavonoids? They're chemicals in citrus that actually repair the blood vessels. So kind of nice. And they're very anti-inflammatory. And then rutin has been found to repair the blood vessels and tissue. Astaxanthin by itself is a very good anti-infectant for atypical bacteria. And then the B vitamins help methylate and get toxins out of the liver. And usually when we've got an infection in our body, we're loaded with toxins. So it's real important to get all of those things out of your body. So, you know, basically, you know, there's other things you can use too. I used the WO oil to get it into his brain because his brain was being affected too. And to make a long story short, I told him it'd take a year to 2 years of treatment for him to improve. Within a month, he showed so much improvement, his wife wanted to just keep getting the stuff and keep getting it. And they, to this day, he's currently 87 years old, and he went back to work because he felt so good. He just wanted to be more active, and he went back to work.
Wow.
87 years old.
Weinstein?
Yeah.
Wow.
Yeah, they're famous.
Never met him at all, have you?
Nope. I've met him spiritually though. So anyway, there's a lot of good stuff we can do for the heart. The H heart is interesting. It's made by Systemics, and it was made to give energy to the heart. When I went through my divorce, I was having a lot of chest pain, you know, before I went to Yosemite. And I would take the H heart every day because it would help my heart have energy. The HCV from Systemics is also good for vascular flow. The Circulate helps get oxygen and nutrients in. There's one called HQ, which is the heart energy, has a lot of CoQ10. CoQ10 is very good for the heart. It's good for this whole chakra. They actually found that if you take 600 milligrams of CoQ10 a day, it prevents breast cancer. Isn't that interesting? As well as helping your heart. So CoQ10 is very good. When I was a medical doctor way back when, I did a lot of chelation therapy for people. And the chelation actually cleaned up the blood vessels by removing the heavy metals and toxins from the body. There's oral things you can take to get rid of the heavy metals and toxins, like there's Meta-X, Tox-X, removes toxins, plastics, petrochemicals. Meta-X removes the heavy metals. Binds to toxins in the intestines and colon. And there's a GSHX and a GCAL, increases glutathione, which helps the liver put toxins out through the bile, and then you bind them with this bind. Oral chelation, EDTA. I had a guy yesterday asking me about EDTA, and I used to give this IV to people. I found that oral EDTA works just as good. So, you know, there's a lot of things you can do. Good, we made it through it. We're at the end. But it's the beginning, because you're all going to live a longer life because your heart and body's in better shape. Because anytime you do good things for your heart, it helps the entire body. Metal Tonify is a Chinese element herb. There's the 5 elements. You know, there's air, water, fire, wood, and metals. Yeah, it's right behind you. Metal, are you asking about which one?
Metal Tonify.
Okay, Metal Tonify actually helps people in a weakened state to remove that weakened energy and become stronger. It's kind of an interesting element. Metal contains the water. You can put earth, you can put fire, you can put everything into metal, and it will hold it. So Metal Tonify actually holds all the other elements. So if you have problems with all the elements and you take Metal Tonify, it'll actually help all the elements within your body. Now, I didn't even go into the hard elements, which are the fire. The heart is considered fire energy. And the fire sedate actually can help people with heart disease. And fire tonify can help people with heart disease, but they do it in different ways. So the fire sedate will get rid of too much fire that will burn up all the energy of the heart. And the fire tonify takes the heart